Auzubillahiminashaitanirrajim. Bismillahirrahmanirrahim. So my name is Saud Iqbal. Now we start further the plab series. So today our topic is coarctation of aorta. So what is the coarctation of aorta? So let's write the definition that the narrowing of aorta is called coarctation of aorta. So what is the narrowing of aorta? What happened? So let's continue to our diagram. So for example, right atrium, right ventricle, left atrium, left ventricle. So what happened here? Here is the aorta rise. The aorta rise from this side. So here are three branches coming from the aorta. So here are three branches coming from aorta. So what is that branch? That branch are called brachiocephalic artery. That are left common carotid artery. Left common carotid artery. And what about that one? So that one are called left subclavian artery. Left subclavian artery. So the brachiocephalic part are divided into two branches. So that part are divided into two branches. So the upper part of branch is divided into right common carotid artery. Right common carotid artery. And that one, they are right subclavian artery. So what happened here? There is a narrowing occur in the aorta. So let's assume that there is a narrowing. The tunica media part are degenerated. Tunica media part of aorta are degenerated. So eventually they cause narrowing occur. So here is narrowing occur. So if the narrowing occur, the blood goes from that side. The blood goes from that side. So here the pressure increases. The upper extremities, the pressure increases, and the lower extremities, the pressure are very little. So now we said that the upper extremities pressure are increased. Pressure is increased, and the lower extremities pressure is decreased. The upper extremities, the pressure is increased, and the lower extremities, the pressure is decreased. So what about the causes? The causes of the coarctation of aorta are a type. The coarctation of aorta types is different types. Congenital type and acquired type. What is the congenital type and what is the acquired type? If the baby is not born yet, and in the fetus the lungs are undeveloped, so in the lungs are undeveloped, so what happened? There is a duct here, and we call this duct is called ductus arteriosus. So what happened if the lung not developed? If the preductal cause, what about the preductal? So if this duct, the ductus arteriosus, distal to the narrowing of the aorta occur, so we call as postductal coarctation of aorta. If the ductus arteriosus proximal, we call it, if here is narrowing occur, so we call it as preductal coarctation of aorta. So in the baby, in the fetus, if the cause is predator, most probably cause. If the baby is born, if the baby is born, normally if we burn the this ductus arteriosus is closed. So here is obliterated close, because if we burn the first time we breathe, the first time our lung are to open, and the first time our oxygen is to the lung receive, and blood supply to the heart is normally goes to the lung and the pulmonary arteries and the pulmonary veins. So here the pulmonary arteries are going to aorta, because the ligamentum, the ductus arteriosus is closed, so we call as ligamentum arteriosus. Ligamentum arteriosus. If still ligamentum arteriosus is closed, so the baby is born. So if there is cause, the baby can cause cardiogenic shock and cyanosis and early death. So this is a very severe case. If acquired cause, what is the acquired cause? If you burn is in a normal aorta, and after that, in some reason, some causes after that, their coarctation of aorta happened, so we call as acquired cause. So this is the coarctation of aorta. So what happened? The blood goes to the aorta. From the aorta there is ascending aorta, there is proximal aorta, and there is descending aorta. So there is ascending aorta, there is arch of aorta, and there is descending aorta. So what happened? The descending aorta, here is the pressure increase. So if the pressure increase, the medial degeneration increase. So what happened here? Here is the aortic rupture. Aortic aneurysm occur if we left untreated. The aortic rupture, if we left untreated. If that arteries goes to the brain, if we left untreated, there is hypertension to the upper extremities, very aneurysm, and the arteries are in the brain. There may be stroke occur in the brain. So this condition is very, very severe. In the lower extremities, if the blood supply is not come to the properly, so what happened to the lower extremities? The lower extremities become maybe claudicated, and there are maybe pain occur. Radio femoral delay. So in the coarctation of aorta, there is radiofemoral delay. If we measure the pulse, the radial pulse, if we measure the radial pulse, there is an increase. If we measure the femoral pulse, there is decrease. 1 point. If we measure the BP, so there is upper extremities BP, there will be increase. If we do lower extremity BP, so there will be decrease. 2 point. Now the third point. What is the third point here? So let's assume that if we said that there is a right brachiocephalic, there is a brachiocephalic artery, so here one branch is the branch is coming from this is subclavian artery, right? Subclavian artery. So the right subclavian artery will go to internal thoracic artery. So that will goes branch to anterior intercostal arteries. here are collateral anastomosis occur. Collateral anastomosis occur. So here a descending aorta, here is aneurysm occur, coarctation occur, and here is posterior intercostal artery. So normally, if here pressure decrease, if the descending aorta, the pressure is increased, so what happened here is pressure decrease. So the normally if the pressure here increase, the aorta, and we said that earlier that, for example, this is aorta. For example, this is, normally the blood supply is going to that side. The blood supply is going to that side. So here the pressure occur, here is the pressure is increased because there is coarctation narrowing of aorta. So what happens if the pressure increase here, so the blood goes to that side, that side. So the collateral blood supply goes to that side the very first time, there are goes to and drain into the descending aorta. So what happened? There is the intercostal artery. So the intercostal artery are become very enlarged. These arteries are become very enlarged. So in the X-ray we see that there is enlargement of arteries and knocking, and they knock the rib. If we auscultate and if we found there is a knocking the rib, so in the coarctation aorta we found that there is a knocking the rib. So here is another point. So investigation of choice is MRI, and we see the aorta and related arteries. For example, internal memory arteries, internal thoracic arteries, anterior intercostal arteries, posterior intercostal arteries, we see that. In chest X-rays, we see aorta coarctation and these arteries. And radiofemoral delay, and the treatment. If mild, no treatment. If moderate, surgical. Surgery, stent. For example, here is coarctation of aorta, so we bypass that, and the bypass graft we give here. Bypass surgery, balloon, stunt balloon surgery. In the child, we do not stunt yet because they grow and the aorta also grow, their size, the stunt are same. So the stunt are not until we see the child condition. And antihypertensive, plus if cardiogenic shock, dobutamine. And here is association, Turner syndrome, bicuspid, mitral valve. And complication, aortic aneurysm, infective endocarditis, left ventricular hypertrophy, and eventually left ventricular failure in the brain berry aneurysm. Stroke, a lot more. So now quick review that if here coarctation occur, so if here coarctation occur, so the pressure is increased that side. The pressure is that side increased. So what happened? So what happened? There is aortic dissection occur, aortic dissection, aortic aneurysm occur, and aortic rupture. If aortic rupture, the internal bleed and the patient may be collapse if the aortic rupture occur. So here is the aortic dissection, aortic aneurysm, and aortic rupture occur. If the upper extremities pressure is increased, what is the brachiocephalic artery? What is this? This is left common carotid artery, and this is left subclavian artery. So if the upper pressure is increased, so headache occur, blurry vision, and thunderclap headache, and subarachnoid hemorrhage occur, berry aneurysm occur, which rupture, subarachnoid hemorrhage occur. So stroke occur. So this is the complication of upper extremities. So that disease we call it postductal. What the postductal? Because here is left subclavian artery. So here is distal to left subclavian artery, but there is a duct. We call as ductus arteriosus. So distal to ductus arteriosus. So we call it postductal artery. If there is coarctation occur, so here also distal to the left subclavian artery, but proximal to ductus arteriosus, we call as preductal artery. So what happened if normally the pulmonary arteries give the deoxygenated blood in the baby, give to the ductus arteriosus and drain into the aorta. So what about, so if the coarctation occur, so normally they give to the aorta. So what happened to the extremities, lower extremities? The lower extremities become cyanose because the blood did not receive the oxygen, because here is 40% also oxygen present here, and the in pulmonary arteries give deoxygenated blood to in the ductus arteriosum and give to the aorta. So if they block, the cardiogenic shock, because the pressure here is up, and mix the oxygenated and deoxygenated blood, so the cardiogenic shock may occur, and the baby may become irritable, and decrease appetite and diaphoresis. Investigation of choice is MRI. And if the pressure here is occur, so there is a subclavian artery, there is brachiocephalic artery, there is left subclavian artery. They give branch to the subclavian artery, right subclavian artery. So here the pressure increase. Now there is the pressure decrease. So here the pressure increase the upper extremities. The pressure increase. So the internal memory artery, the internal memory artery, the pressure is also here is increase internal memory artery. Why memory artery? Because they give the branches to the breast, and we call it, this artery is also internal thoracic artery. Here is anterior intercostal artery. So here also pressure is increased, and there is posterior intercostal artery. Here also pressure is increased. So they, the first time they give the blood supply to the aorta, because normally that side the blood supply goes, but in this case that type of supply is that side also goes. So here is the arteries become very enlarged and they touch to the rib. They touch to the rib. So we call as rib notching. We call as rib notching. Rib notching occur. Rib notching occur here. So and the X-ray, we in X-ray we see three sign. We see the X-ray. Why? Because this is the aorta. So there is coarctation occur. So here is the aorta and here is narrowing. So we see the three sign. And surgical treatment, balloon stunting, and all of the, this is the plab series. And